Okay, so we have a very fresh topic in our hand today. Not fresh, I would say, but intriguing for sure. And that topic goes by something we call as AIDS. Okay, caused by HIV. HIV is a virus, as we all know, human immunovirus. As the name suggests, it compromises our immune system, or in a way, our immune system's ability to fight against diseases. Okay, so in case of infection with a person, if a person gets infected with this human immunovirus, the helper cells, the T cells, or all the other major immune cells, they get decreased in number. Okay, so if they decrease in number, they won't be able to perform as better they should in the normal conditions. So let's get started with this thing. We call it as acquired immunodeficiency syndrome. Okay, this word syndrome has a meaning over here. We'll see about that. See, when we say about acquired, and when we talk about syndrome means it's a cluster. Okay, cluster of what? Symptoms. Okay, I think this much is clear. And when we talk about acquired, I think you understand from the term acquired that it is gained in the lifetime. Okay, which means it does not come genetically. Okay, see, if HIV/AIDS was a genetic disease, the entire humanity would be doomed. Right, that is the case as we talk about it. So you know when we talk about immunodeficiency, it signifies that the immune system has become very very weak, right, and it cannot deal with a very simple of very simple to simple of the attacks that our body is going to have. So, for example, if a person is infected with this human immunovirus, and then he or she comes under the influence of, say, rhinovirus, okay, cold, common cold, or fever. Now, in this case, uh, the immunity of a person is compromised up to a level where he or she, won't be able to fend off this very, weak virus such as rhinovirus. Okay, so if she or he has got a cold, well, they are going to have a very tough time with that. Okay, so let's move on with our topic. So when we talk about immunity, when we talk about immunity, we have immune cells. Okay, and in immune cells, what we do, we talk about lymphocytes, T cells. So we talk about T cells, we talk about B cells. But majorly, you will see that in these cases, we talk about T helper cells as their number decreases significantly in case of HIV. Okay, so this is a common makeup of HIV, or which is the causative agent of AIDS. It's a very common makeup. Okay, this sums up what happens when you get infected with it. Okay, the destruction of helper cells or lymphocytes lead to the development of a cellular immune deficiency, which makes the patient susceptible to a wide variety of diseases. Okay, now syndrome, as we talked about, it's a cluster of symptoms, sign, physical or physiological disturbances, right? So caused by a common progenitor, right? This is an important thing. So as a result, even a small cold leads to pneumonia, right? And minor infection leads to severe diarrhea. Okay, and blood loss and a simple skin rash will develop into an ulcer. So I think we can determine the seriousness of this disease from here, from these such things. Okay, so AIDS was if we talk about the history of AIDS, AIDS was first discovered in which year? 1981 in America. Now the thing is, this HIV virus or AIDS is said to have come from the monkeys. Now, how did it come from monkeys into humans? That is something we need to ponder over. But let's not get into the wrong direction. Some unnatural relationship between humans and animals. It may be possible that the monkey and the humans have fought at one point, right? Say if an infected monkey had attacked a human and the human to fend off the attack, he tries to chase away the monkey, and in that period, monkey gets some wound, okay, and human gets wounded, and the blood, uh, gets transferred from the animal to the human. As in few movies, if you have watched the movie Graven the Hunter, you would have seen that a blood drop from the lion's wound, it seeps into the scars of the main actor here, and then he gains the ability, some supernatural ability, right? He could jump higher, he could hear, very from a great distance. He could smell things which are not generally possible for normal human beings. So this might be the case, how HIV would have spread from monkeys to humans. At least that's what we speculate. Okay, that is a matter of speculation. So um, what is the deficiency if you talk about, sorry, deficiency, no. I'm talking about the pathogen, right? We were talking about the pathogen. So if we talk about the pathogen here, what was the pathogen? It was HIV, right? Human immunodeficiency virus. Okay, I'll write it down. Let's see this. Human immunodeficiency virus. Okay, this is the pathogen. And what sort of pathogen it is? So it would be a retrovirus, right? Retrovirus. And what does retrovirus has? RNA genome. This RNA genome is going to play a very key role in all of this. Okay, so before we move further about the modes and mechanism, the life cycle of these things, let's just talk about the possible way through which this virus could travel, through which this virus could transfer, right? So if we talk about mode of transfer, huh? We could think of a lot of things, and number of things we could think of, right? So let's say mode of transmission, maybe the most common thing is unprotected sexual contact. Okay, why? Because the fluids of the body gets exchanged during the sexual intercourse, right? If a female or a male is infected with this virus, and you know try to indulge with that person, the internal fluid of your body gets exchanged between the partners, which could lead to the transmission of HIV from the infected person to the healthy person. Okay, so that is about unprotected sex. No, the second thing we could think of is transfusion. Transfusion of infected blood, right? If a person has HIV and the blood of the HIV infected person is transfused into a healthy human being, that blood would carry HIV viruses with itself into the healthy human being and sabotage the immune system of the healthy person. Right? Now, the other way of transmission would be infected needles or syringes. Well, the chance of this infected needle or syringes is quite low these days, because even poorest of the poor pharmacy or the dispensaries, they use disposable syringes, disposable needles these days. But the problem is with the druggies. Who we refer to as druggies, huh? The drug users. And what sort of drug users? The drug users are various kind. Some snort, okay, some chew. Then some may use pills, and then some share IV. What do we call this IV? Intravenous. Now, how do I know about all these things? I do not do drugs. Okay, I've seen it in movies, a lot of it. So what happens when we use this, IV as a method to get high, to feel good? What happens when you insert a needle into let's say that this is your blood vessels, okay, and this is the blood over here, and then you're using a needle, and this needle is inserted here, okay, this needle is here. So if this needle is inserted in your vein, it is here coming in the contact of blood, okay. Now this needle will carry the fragments of the bloods, okay, the blood cells. Now you take this needle and you inject it into a healthy human beings blood vessels. So the HIV viruses will get a new home rent free, right? So this is one of the way by which HIV could manifest its transfer from infected person to healthy person, right? Now let's talk about another possible mode of transfer which could happen. So another mode is from infected mother. Okay, infected mother to fetus. Now you would say, I mean, if we are talking about fetus, it is very obvious that the baby, is still inside the mother's womb. It has not come out in the world yet. So there is something we call as, you know what, placenta, right? Placenta. Okay, and it is a barrier between whom? Between the mother and the fetus. Okay, so this placenta, it's selective. Highly selective. Highly. Okay, it does not allows the transfer of blood. Okay, so now the question arises: if the placenta does not allow the flow of blood through placenta from mother to fetus, how is it possible that the baby is getting infected? Is getting infection, right? So the thing is, it doesn't matter if mother is not, sharing her blood with the fetus, but there are, transfer of fluids. Okay, see, mother and fetus have a very different sort of relationship. Okay, some may argue that the relationship between mother and fetus is of commensalism, right? And some may argue that the relation of mother and fetus is parasitism. Okay, but it depends on the case. Okay, so if mother has some issue, fetus always send some of the cells, to help boost or repair the damaged cell of its mother. And in case the fetus is suffering with some sort of issue, some sort of damage, the mother always sends some helping cells to rebuild the baby's lost apples, right? So this is the case here where the nature of existence of mother and fetus would be referred to as commensalism because no, sorry, I'm using the wrong term, not commensalism, mutualism. Okay, mutualism I'm talking about. Okay, mutualism. In mutualism, both the parties who host and the guest benefit each other. Right? Commensalism is a different concept. So the relationship between mother and fetus is generally mutualism, but in certain cases, right, where fetus starts using mother, for its own selfish need, and the mother starts dying. In that case, we will call it what? Parasitism, because the fetus is living, is feeding directly, and regardless of what its mother needs. Okay, so in that case, we will call that the relationship between mother and the fetus is here what? Parasitism. Okay, so that is the thing over here. Now, the other possible way of transfer, is through lactation. Why? Milk is present there. Okay, fat globules would be there. Mm. Essential nutrients are there. But the important thing is there is flow of fluid, bodily fluid, not to forget. Okay, so this bodily fluid may carry the HIV infection, which gets transferred from the mother to the baby. Okay, so this is mm, the mode of possible transfers that we can think of. Well, obviously, there could be n number of ways through which it could be transferred. Now let's talk about there are two things. Okay, the first thing is a manifestation of HIV. Okay, manifestation. So HIV could take somewhere between 6 months to 10 years to manifest itself completely, which means that it could remain asymptomatic up to 9 years and even up to 10 years. Okay, asymptomatic. It won't show any symptom. While on the other hand, it could show its symptoms, before 6 months also, within 6 months also. Okay, but this is the general manifestation time of this HIV virus. Okay, so let's talk about the major thing, that is the life cycle of this HIV virus. Okay, so we'll move to that now. It's a very important thing to understand the life cycle of HIV virus, right? I hope that you are familiar with macrophage, right? Because this is going to be the very important player right here in the life cycle of the HIV virus. Okay, so let's see. We'll first draw a certain thing. Let's start with drawing this. I'm not that good at drawing, with the with this computer tool, so forgive me for that. What are we drawing here is this thing. Okay, this is our macrophage. Okay, and this macrophage is termed as factories of HIV. Okay, I think that much is clear. So let's start with it. I'm speaking a bit slowly to to keep in mind that I must not miss any of the important things. So if you think that it is too low, you are always welcome to 2x the speed of the video. It would be better, right? Or even 1.75, 1.5, whatever you like. But it's okay. I'm recording at the night time now, so it's better to speak slowly. Okay, so let's start with this thing. So what would we have here first? Okay, we will have here first the HIV virus. Okay, the retrovirus, right? So say we have retrovirus here. This is the retrovirus, and these are. I'll tell you what these are. These are what? ssRNA, single strand RNA, and these two, okay, these two are called as reverse transcriptase. Okay, so this is the viral RNA core. Now, what is going to happen? That this thing is going to enter the macrophage. Okay, so along with the help of reverse transcriptase. Oh, sorry. Just a minute. So what we have here is, reverse transcriptase was there. So with the help of reverse transcriptase, this ssRNA turns into ssDNA. Okay. So now it has turned into ssDNA. Okay. Now this ssDNA will incorporate itself into the host nuclei. Okay. This is the nucleus. These are the genetic material. Okay. So this is the host nuclei. So, when it incorporates itself into host nuclei, what they start doing is now that they start producing, more viral molecules, right? And then, there are more viral RNAs, okay? There would be more viral RNAs, and these RNAs, upon translation, and I hope you know what translation is, they started producing viral proteins, okay? Let's see that these are the proteins. These are the viral proteins. Okay, they start producing proteins. Okay, there will be more viral RNA. So this breaks the macrophage. Okay, it starts going out to various different cells, and then they start infecting them. Now, what happens in the state of infection? This macrophage releases something, and it releases what we call as interleukin. Okay, it releases interleukin. What interleukin does that it goes and binds to the CD4 receptor. You have to remember this. It's bind to CD4 receptor of the T cells. Okay, it's important. Where it binds to the CD4 receptor of the T cells. As a result, the number of the T cells decreases drastically. How drastically? So let's say this is a normal human being with hopefully functional, body organs. He is smiling. So in a healthy human, the count of helper T cells is somewhere around 800 per mmq. Now you can imagine the area. mmq is very, very small, right? If you're talking about the cells, the bodies. Now let's transition this healthy human into infected one. There would be signs of danger, right? So this is a person who is now infected with HIV, and he is not functional. He is sickly. So let's draw. Okay, he's suffering. Okay, with HIV virus. Let's say. So this is what our infected human. So in the case of infection, the amount of T helper cells will drop down to nearly 200 per mmq. Okay, so the shift, this shift, okay, from 800 per mmq to 200 per mmq, in regards to cell is not a joke. Okay, this is a disaster, right? So as the number of T helper cells decreases, okay, T helper cell decreases, our immune system, it starts crashing. So if immune system starts crashing, even if there is, very, very minor scratch would turn into, ulcers, right? A simple flu would turn into pneumonia and many other such things. So this was about the life cycle and how this entire manifestation takes place. Okay. So I hope this is clear. Now let's talk about the diagnosis. Okay. How we can catch what's happening. Let's talk about the diagnosis and let's talk about the treatment. Well, it's not a good news if you know about the diagnosis and the treatment. So diagnosis. The diagnosis, we use ELISA, or some people pronounce it as ELISA. What it is? Enzyme linked immunosorbent assay. I'll tell you separately in some different video about this ELISA thing. So this is how we diagnose if the person is infected with HIV or not. Okay, this is the diagnosis. And one more thing, I made a mistake here. Okay, this question is some asked in NEET also, right? The full form of ELISA. It's not enzyme linked immunosorbent assay. You have to keep in mind. It's enzyme linked immune sorbent assay, right? It's immune, okay, not immuno. Keep in mind. This is, it comes in the question of NEET. And people often get confused with this type of question where the options are more or less true in a sense, and it does not make I mean, to us it does not make much difference, right? But nevertheless the answer could be wrong, right? What is the treatment? Now every disease is a treatment, right, in medical history, except a few diseases. So I'll give you good news: no treatment. Okay, there is no treatment. Death is inevitable. Okay, there is no treatment. Death is inevitable. Yes, people, try to keep the patients on multiple steroids or antibiotics, a lot of things. Okay, so it may, it may prolong the life with a very, very thin margin, right? Very thin margin, by a few months, by a few years, right? But you have to die before age, before normal natural age. You have to die if this is there, right? So there's something in the medical world. I'll tell you about it. Not medical world. It's very general thing. Let's change the color here. Let's make it more dramatic. How do we make it dramatic? Okay, we can try blue. Make it bold. We say, I think most of you have heard about it. Prevention, okay, is better than cure. Okay, I don't know how many of you agree with this thing, but I think it's the best suited philosophy, you could say. It doesn't just work in the term of medicine. It works in almost every aspect of life. If you are traveling somewhere and you know that it's night time, okay, and you're alone, it's better if you stay at the place where you are taking off from, right? Or if you call someone, you don't know what's going to happen. So prevention is better than cure. How prevention is better than cure? Let's talk about that. Okay, preventive measures. Preventive measures. How you could help yourself not, get this boo-boo. So the first and foremost thing is education of AIDS. You tell more and more people what it is, okay, how it spreads, right? And the second thing is protection. Okay, in protection you have condoms, you have caps, right? After that protection, you know, you have, I mean, if you are a druggie, or if you are not just visiting a hospital, or if you are a practitioner of some sort, or even if you run an illegal dispensary in the corner of a village, high up on the hill where hardly anyone visits. So if you are such practitioner, always use disposable needle or syringes, right? This could be one of the way. If you are a druggie also, drug abuser also, it would be helpful. Okay. Now, create positivity. Positivity. About what? Not AIDS, okay? You do not have to create positive about AIDS. That oh, हो गया ठीक है कोई बात नहीं चलता है. No, you do not have to do that. You don't have to create positivity about AIDS. Okay, you have to spread positivity among the patients. Among patients, okay. You do not discriminate against them, right? You don't make them feel bad or any such thing which could make them feel that they have done some bad thing. Because it's not necessary that if a person is involved with multiple sexual partners, then and then only he or she will be infected with HIV, right? Because we have seen how it spreads. There are multiple ways. Okay, so you have to spread positivity among the patients that okay, it's fine. I mean, you have to die anyway, so die happy, right? You have got what 2 weeks to leave, to 2 weeks to leave and 2 weeks to live. So I saw, it's fine, happens. So positivity. I mean, this is not positivity. I mean, but still, you understand what positivity is, right? So you have to spread positivity among patients about it. Then there is something we called safe sex. Protection we have already mentioned. Okay, refrain from multiple sexual partners. You never know who has got what sort of infection. Even if you are clean and someone is infected, you know, people sometimes carry resentment. I don't know if resentment is the right word. It is the right word, I guess, or not. It's fine. If they carry any malice in their heart, and they are already, what do you say, prejudiced by the society that this person must have done something wrong. In most of the cultures in villages and backward areas, it's still considered a form of sin, like he must have, she must have disobeyed God, he or she is an abomination, right? A bad omen. So these type of things are still very common in our society. So we have to be very careful about it, because if you make this patient, segregated, alone, caged. So what happens if say if I'm or if someone from your batch, from your school, from your college, or from your office is infected with this HIV, now you guys are altogether avoiding him or her. Let's just assume he or she wakes up one Monday with a nice needle in his or her hand. He pricks himself, pricks herself, carries that needle, in the lift, in the parking lot, in the lunch area, and then he or she starts pricking you guys. Boom. The epidemic is there of AIDS. Everyone is now part of their sin now. Okay. So we must spread positivity, and there is one more thing. If you are eating with a patient, if you are sitting with a patient, if you are talking with a patient, if you're sharing a towel with this patient, you won't be infected by the HIV. Okay. It's not a fomite. So fomite, you understand this thing. It's not an airborne disease. Okay. So if it's just imagine if it was an airborne disease, and say if I have or someone from you have this disease and you sneeze or cough in the market, next day you get the news that 500 or 500 or 1,000 people, all of them who were in the market at that particular point of time, they're all infected with this disease. Okay, so these are some of the common notions that we still have in our society in some corner. So we need to get rid of these things. Okay, and if you are suspected of such thing, or you suspect that you have it, or even you may not have it, it's always to get yourself checked up. So regular checkup would be a very good thing, in a sense, in a preventive way. Okay, in a preventive way, regular checkup would be a good thing. So this sums up what we have studied till now. Okay, so we'll just do a quick revision of it. Okay, quick revision of new R. So let's just do a quick revision of it of what we have learned, right? So we have learned that HIV is a retrovirus. Okay, It causes our immune system to crash, right? It was seen in 1981 in America. It spreaded through monkeys. The first case I'm talking about, right? So, and it's the disease it causes is AIDS. All right, it's a cluster of symptom. Okay, it cannot be treated. Okay, so the retrovirus RNA turns into ssDNA. It goes into the nucleus of the host. Okay, then it starts producing a viral molecule. You know what viral molecule? RNAs. Okay, and then there is further infection. This releases what? Interleukin it releases. Okay, it binds to CD4 of T helper cells. The amount goes down to 200 per mmq, right? And then you die. That is the end result. Okay, this was the mechanism. And then we talked about that it's not airborne. Okay, does not spread if you eat, sleep, or sit with the infected, person. Does not spreads through a towel. Okay, what it spreads through? Needle, infected needle. Okay, it infects through blood transfusion, mother to fetus, if infected. It's the mother, and there are many more things. So this sums up about the life cycle of HIV, HIV/AIDS, what HIV/AIDS is, and if you have any questions, just let me know. I'll try to solve it at the best on my level. Okay, so let's see you again soon.